Hello, Stow-Kent Chiropractic and Neuropathy family. I want to go ahead and talk to a mentor of mine that I've been using about the Softwave unit that we're getting. We're super excited about it, and he's just outside of Philadelphia, Pennsylvania, Dr. Dan McClimon, and he's going to go ahead and tell you a little bit more about the machine because he's been using it now for a few years. So go ahead, Dr. Dan.
Well, hi, everybody. I'm so glad to be able to share a little bit of time with you. Softwave has been incredible for my life and my family personally, as well as our practice here in Southeast Pennsylvania. We're just very blessed to be able to see hundreds and hundreds of people a day. And so we've been doing this for over 3 years with Softwave. And the things we've seen are incredible in terms of a natural, non-invasive way to not just help with pain and range of motion and function, but to actually help people start getting regeneration in their tissues and joints. So we see a lot of knees, shoulders, hips, low back, plantar fasciitis, elbows and wrists. I could tell you all kind of stories, but it's one of the most amazing things that I've ever seen in my career. And I've been very blessed to be able to speak at conferences all over the United States and hear doctors and surgeons and folks from all over the world talk about their experiences with Softwave. And I'll just say this, surgeons who've been in practice over 30 years are doing less and less surgery and more Softwave tissue regeneration because of the technology that we now have.
Okay, well, that sounds amazing to me, and I can't wait till we get our units. Can you tell them a little bit of difference between degeneration and regeneration so they can have a better idea?
Absolutely. So I ask people, they might say my knee's been bothering me. I had some old injuries and I've worked my whole life, etc. And, we'll often look at the x-ray and we'll talk about this knee. And I'll ask them, is this knee every day that you're walking around on it, using it, is it currently in a state of degeneration or in a state of regeneration? And if they're not doing anything to proactively work on regeneration, it's in a state of degeneration, meaning every day that car's out of alignment, it's running harder on the car, the tires are wearing out unevenly and more quickly. Same thing with the knee in this example. So what we want to do is we want to use our body's God-given ability to heal, repair, and regenerate healthy new tissue. So I call that not just playing defense and trying to slow down degeneration, but actively get the body in a state of regeneration, or in other words, going on offense. So with the knee, we're talking about the cartilage and the meniscus tissue. We're talking about the ligaments and the tendons. Same thing with the shoulder and the hip and the ball and socket joints, the labrum, the cartilage, the ligaments, the supporting tissues. Same thing with the spine and the disc material and the ligaments around that. We want to be regenerating as much as we can.
Okay, so in the regenerative process, this unit then is getting what they sell local stem cells to come to that area. Now, I know when I got diagnosed with cancer last year, I went out of the country and spent quite a bit of money to get stem cells because they don't do IV stem cells here in the States. So could you explain a little bit about what the stem cells are and what this machine's doing?
Absolutely. And actually it's interesting, that we touch on this topic because they call it the stem cell machine. And it was featured on that TV show, The Doctors, and they call it the stem cell machine. But, as you mentioned with your experience, there are a number of options in the world of regenerative medicine and stem cell care. But what I tell our people is we believe that we should always start least invasive, most conservative first. And then if you need to, you can always work your way up the ladder with different injections and IVs and different surgical stem cell procedures before you would have to do a last resort joint replacement or surgery. And so we start least invasive, most conservative first, but it is, make no mistake, in the world of that regenerative care and that stem cell care. So what Softwave does is this. It's a special type of sound wave, or in other words, an acoustic wave. and it travels very fast through the tissue. And three things happen immediately. It doesn't damage tissue, but it mimics injury. So the body will send the healing response there. So no tissues get damaged, but three things happen immediately with the soft wave care. One is it will clear what they call senescent cells, or in other words, dead cells, damaged tissue. It clears the senescent cells, it brings in blood flow, and it helps to modulate the inflammatory process. So that all happens immediately, right away when you do soft wave, even for the very first time. And almost every person, over 85% of people, are going to feel looser, lighter, less pain, easier range of motion. Like somebody put WD-40 in there. Just so, I mean, I've had plenty of people in tears, haven't been able to, get up out of a chair or walk up and down the hallway without stiffness and pain for 30 years. One session of soft wave and it's dramatically different. But I always tell people nothing is fixed after that initial response. But the reason that we have multiple soft wave units in our office, and we've been doing this for years, is because of what happens next. What happens in the days and weeks and even months following a soft wave session is it causes what they call resident stem cell migration. So your body's not somebody else's stem cells, not invasive, but your own stem cells will migrate typically from the bone marrow to the area of damaged tissue. Say we're working on a knee, stem cells will migrate to the area of damaged tissue where they can then work to repair, heal, and regenerate new healthy tissue. And that process will happen for the next 3 or 4 months, even up to 10 months, according to the research. That's called remodeling and regeneration.
Yeah, that's really exciting that we don't have to either. I know they can take it out of our fat cells and our bone marrow and put it back in and to specific areas, and what I had to go through to leave the country. So this seems like most conservative, and the results are amazing. Could you give us maybe a couple stories of one or two patients that had some pretty cool results?
Absolutely. And there are a number, and I'll tell you some people that we've personally taken care of, but a lot of people that celebrities, pro and Olympic athletes, there are, I mean, LeBron James and Tiger Woods and famous movie stars and Olympic athletes, a lot of the pro sports teams, baseball, football, basketball, golf, Olympic teams, they're using Softwave on a regular basis. I could tell you a lot about all that. They actually use it on a preventative basis, a lot of them. But personally, one guy that always comes to mind, his name is Frank, and we've taken care of him for years with chiropractic care, him and his wife, and he's done really well in a lot of areas. But Frank works in a lab over a microscope, and he's one of the most selfless, humble, servant-hearted guys that you'd ever meet, and just very soft-spoken, but a real hard worker. But he couldn't lift his arms up above about here. He couldn't get them over his shoulder height. He was just restricted that way. And we did one soft wave session on him, and Frank takes his arm, reaches up and over his head, and he's a real man of few words. His eye, very quiet, his eyes lit up. I could touch my ear. I could touch my ear. He reached over, I'll never forget it. And then he reached behind his back and he said, I could get my belt through my belt loops again. So that range of motion after one session in his shoulders is very dramatic. And that was so cool to see. I mean, he was tearing up. It was very impactful. And I mean, I could tell you about my dad and his knee, and a lot of folks that we've taken care of. One lady, she couldn't open a jar. She loved to garden. Her handwriting and her grip strength was suffering. And within 4 or 5 sessions, she said, I feel like my hands are back to normal. One other guy I'll just briefly tell you about is actually my uncle. He woke up, Uncle Dominic, he woke up one day and his whole left side, he could barely use it. He couldn't even grip a fork and a knife. They thought he had a stroke. Long story short, he called me up. He said, Dan, they're wanting me to go to a neurosurgeon to get a consult to have surgery on my neck. I said, look, Uncle Dom, you need to come in. I need to check you out. We did some imaging, did some x-rays, wound up doing Softwave. We got him adjusted, but he had issue in his lower neck, in his shoulder, and then all the way down in his wrist as well. And within 3 sessions, he had over 80% of his feeling and strength back, almost like it didn't happen. And then within 9 or 10 sessions, it was almost like it never happened. And he was about to have a consult to go under the knife to have probably fusion done in his neck. And so I'll never forget that one either. And again, I could go on and on about plantar fasciitis and neuropathy and knees and hips and all kind of stuff, but it's really a blessing to be able to have it.
Yeah, that is amazing. So some great stories. Now we've been setting up some mapping sessions, and if you haven't called to get in on a mapping session yet, and we're only letting it for our patients, their family, their friends, their coworkers, fellow churchgoers. But tell them what they can expect from this mapping session. What is it going to entail for them as far as using this unit on them?
So, I mean, that's really it. And that's what I always tell people is get in and get checked, get a mapping session. And so what that means is, the doctor team will talk to you about, and hear from you what's going on, what are the concerns that you have, et cetera, maybe do some imaging or an exam. But the thing about Softwave is this, is that it is what they call a diagnostic tool as well as a therapeutic tool. So meaning when you do the Softwave and you do it over healthy tissue, you don't feel it at all. But as soon as that Softwave finds damaged tissue, you're going to feel it. It's going to be a little bit uncomfortable, nothing crazy. But what that means, what that's called is biofeedback. Your body telling you there's damaged tissue here, but there's not damaged tissue there. And then you can tell your doctor or team of providers right where those spots of damaged tissue are without needing to do surgery or invasive imaging and procedures. You can tell right where the damaged tissue is. So when we say mapping session, if someone has a shoulder issue, we're going to go ahead and do the Softwave all around the lower neck, the front and back and side of the shoulder, the rotator cuff area where the tendons come up through. And we're going to be able to tell and literally map out and write down notes on a paper where those spots of damaged tissue are. And that's going to help us to determine whether or not you're a candidate for care and what you can expect for improvement with the Softwave care. Plus, you're going to feel in 85+% of scenarios on the first mapping session, you're going to feel somewhat, if not significant change and improvement. So it's just really, honestly, it's a lot of fun. When we started doing this over 3 years ago, about here in our Pennsylvania office, we saw hundreds of people right off the bat, and it was some of the most fun we've ever had in practice because it was just amazing changes in people's lives, joy just coming back and being these improvements 20, 30 times a day, So that's really what a mapping session is, and it allows you to experience the technology and then see if you're going to be a candidate for it.
Well, that's awesome. I really appreciate your expertise and all the knowledge that you've shared with us. Again, if you haven't called the office yet to get in on the schedule, because I know we're going to have a waiting list by the time we launch it to the public. So, but we appreciate Dr. Dan coming on and giving us all his valuable insights, and we really, really look forward to helping you out.
Well, it was a pleasure to talk to you guys. And just to say it one more time, I always tell people this. If you or a spouse, someone in your household, family member, coworker, loved one, friend from church, whoever it is suffering with a joint issue, knees, elbow, shoulder, low back and hips, neck, mid back, ankles, wrists, feet, plantar fasciitis, neuropathy, among many other things. We could go on and on about the uses for it, but those are the main things. If you or someone is suffering with that, pass this video along to them and have them get in on this, what I call a friends and family special, this limited time period where they're going to be doing these mapping sessions for folks. Go ahead and get an appointment. It's very simple to do. And then you can really bless people by passing this along, because I can't tell you, and when I train with my team, my wife and I are always reminding our team, there's literally people hoping and praying for an answer, for a solution to their knee pain, hip pain. They don't want to have a joint replacement, but they don't know what else to do. So this could really be a blessing for them. And so I'd just encourage you to think about whoever else you can help as well.
Well, fantastic. Again, thanks for giving us the time and your expertise. And we look forward to getting our unit and helping a ton of people.